Excellencies, distinguished guests, protecting human rights for all people is a precondition for individual well-being and for sustainable development. Sexual and reproductive health and reproductive rights are aligned to the enjoyment of many other human rights, including the right to life, health, education, equality and non-discrimination, privacy, and individual autonomy. UNFPA works to empower individuals and communities to claim their sexual and reproductive health and rights and advance gender equality to achieve the vision of the 1994 International Conference on Population and Development Programme of Action and the 2030 Agenda for Sustainable Development. The impact of COVID-19 pandemic threatens to undo years of progress in advancing women's health and rights. We have seen sexual and reproductive health services disrupted and human rights under increasing pressure around the world. Now, more than ever, we must stand with women and girls and stand up for their human rights. This year, the High-Level Political Forum on Sustainable Development will deliberate on building back better from COVID-19 while advancing the full implementation of the 2030 Agenda. UNFPA urges all stakeholders to renew their commitment and take strategic action to advance sexual and reproductive health and rights and gender equality. It's of critical importance to the broader sustainable development agenda. And for UNFPA's part, as reflected in our recently adopted strategic plan for 2022 to 25, we will continue to push forward for women's and girls' rights and choices. Our efforts focus on achieving 3 transformative results by 2030. 0 unmet need for family planning, 0 preventable maternal death, and 0 gender-based violence and harmful practices, including female genital mutilation and child marriage. The promotion and protection of human rights, particularly the rights of women, girls, young people, and those population groups whose sexual and reproductive health and rights are most at risk, will help us accelerate progress and reach those furthest behind. For UNFPA, standing up for human rights in particular means 3 actions: helping address inequality and discrimination, supporting governments to provide quality services aligned with international human rights norms and standards, and strengthening accountability systems to bring to light systemic and structural shortcomings that underlie human rights violations. Together with our UN partners and civil society organizations, UNFPA supports intergovernmental processes for the development of international human rights standards, as well as accountability frameworks for monitoring the implementation of recommendations on sexual and reproductive health and rights. Yet, norm setting needs to be translated into effective implementation on the ground. And to promote this, UNFPA stresses the importance of continued engagement with international human rights mechanisms, such as the UN treaty bodies, special procedures of the Human Rights Council, and the Universal Periodic Review. We welcome the initiative taken by a number of member states in using language from their commitments made at the Nairobi Summit on ICPD 25 to ensure that the implementation of human rights recommendations and related ICPD commitments go hand in hand. At UNFPA, we want to walk the talk, and we know that only that which can be measured matters. So our new strategic plan therefore includes an indicator to assess the follow-up and implementation of recommendations of international and regional human rights mechanisms related to discriminatory social and gender norms and practices on sexual and reproductive health, gender-based violence, and harmful practices. And to this end, we will strengthen our collaboration with government entities coordinating the implementation of human rights recommendations, and we will support the monitoring role of national human rights institutions and all other stakeholders. Human rights laws apply in all circumstances, so building accountability to women and girls across the humanitarian, development and peace nexus is a priority for UNFPA. We are on the ground before, during and after the crisis. We work closely with governments, local NGOs, UN and other partners to ensure that sexual and reproductive health and rights and the prevention and protection from gender-based violence are integrated into emergency responses. We need to work together across the humanitarian, development, and the human rights pillars to ensure a unified response to the needs of vulnerable populations. It's encouraging to see the increasing attention the Human Rights Council is dedicating to these issues. This is essential if we are to achieve our goals to end unmet need for family planning, end preventable maternal deaths, and end gender-based violence and harmful practices by 2030. So in closing, let me reaffirm UNFPA will continue to work together with all of you to meet our obligations and commitments to realizing sexual and reproductive health and reproductive rights for all. I thank you.